Millennials, they're intriguing. They'll find ways to confuse and fascinate you. We know how they feel about some things like Snapchat, but what about something like their health? Jesse Curitan has some insight into that. Good morning, Jesse. How are you this morning?
Mike, good morning. How are you?
Fantastic. So what's the most important thing you learned about millennials from this survey?
Well, there are a number of things that we've learned about them. First of all, this survey was done as a reflection of Novant Health as a health system, really wanting to better understand the needs, the beliefs, and behaviors of our patient consumers, because we understand if we do that and understand their behaviors, we can provide remarkable patient experience. So with the survey, really came some fairly interesting information, particularly around millennials. Now, most of us know that millennials use their cell phones and they're on the internet and spend a lot of time watching television, but ironically, they feel like they do not have enough time to exercise. And so one of the things that we know we need to do is better help them understand the value of putting their feet on the ground and getting out and doing something every single day. The American Cardiology University really communicates to us that if you exercise more than 5 minutes a day, you can extend your life by more than 3 years. And more importantly than that, you can prevent premature death. So we need to better educate that population. The second piece of information that we found, which was really interesting, was that when it comes to how millennials are actually getting information. So again, intuitively, you would think that most of their information would come from the internet, and on one level that's true, but when it comes to healthcare, they've really gone old school. They're doing the same thing that their parents have done in the past, which is actually talking to doctors, talking to nurses for their information. We think that's actually a good thing because it eliminates any misinformation out there that they could get on the internet, and we think ultimately will create a more healthier community for the millennials. So it's pretty fascinating information.
Yeah, one of the other topics I think that was addressed in this survey, end-of-life care. So what's the biggest challenge with that, with end-of-life care in your view?
Well, when it comes to end-of-life care, it's really about education. When we look at the broader community, we find that most people really do not know where to start the conversation around end-of-life. When it comes to millennials, they don't have any clue whatsoever around the value of the education. So from a healthcare standpoint, we know that it's important that we begin to educate the population of the value of having these conversations now. We think it's very empowering that we empower our patient consumers to understand the value of having conversations with their physicians and having these conversations with their family on what their decisions will be when it comes to end of life. We equally see an opportunity to educate, again, our physicians, our nurses. So it's a comprehensive approach to end-of-life discussion. As a country here in the U.S., we haven't done a real good job of talking about end-of-life. We think it's part of the healthcare experience, and we're going to provide education to all the communities in which we reside.
Yeah, and I guess your survey also, it highlights how unequipped adults are to deal with a lot of these issues. Is the medical profession, I know you touched on this, is the medical profession ready for that?
Well, I would say the medical profession is ready for end of life, but again, it hasn't been a predominant part of the education process within healthcare. And that's why we're going to take a very proactive, intentional approach and making sure we're educating our physicians and our nurses. At Novant Health, we have a program that we call Choices and Champions, where not only do we educate our patient population, but we're actually educating the employees as well. It is something that is not easy to talk about. It's very sensitive to most people, but again, to improve the overall health experience, we think is a very important part of the experience.
It is indeed, Jesse. How about a website to go to for more information?
If they want more information, go to novanthealth.org/consumer attitudes.
All right, Jesse, good information this morning. Take care.
Thank you.
All right, a big star.